Pregnancy is divided into 3 trimesters, and each trimester is approximately 12 weeks. Many of the major physiological and anatomical changes will happen within the first and second trimester alone. In the first trimester of pregnancy, important hormonal changes occur. At the time of pregnancy, progesterone levels increase to develop the lining of the uterus, which supports the fertilized egg as it implants to grow. Also, levels of the hormone relaxin are increased from the corpus luteum in the ovary and eventually the placenta, and this hormone will reach its highest levels during this time. Relaxin, as its name suggests, relaxes the wall of the uterus in preparation for pregnancy and eventually relaxes the ligaments of the pelvic region. Other joints can also become more flexible, which can limit the body's ability to stabilize itself. There is an increase in the elasticity of muscles and tendons, which can lead to reduced muscle action during exercise. In addition, there will be an increase in the elasticity and size of the heart, veins, and arteries, leading to dilation of blood vessels. This in turn can cause vascular underfill of the heart, where blood vessels have expanded, but because the amount of blood in the body has not increased, there is not enough blood to fill up the heart. This can cause a drop in blood pressure and create feelings of fatigue and dizziness, known as orthostatic hypotension, with changes in position such as getting up from lying on the floor. During the second trimester, biochemical changes will create new challenges. As the baby grows within the uterus, there is a significant shift in a woman's center of gravity, causing the pelvis to tilt forward and increasing lumbar lordosis. This may encourage poor posture and create low back pain in some women. A woman's weight will naturally increase with the growth of the baby, and there will be a need to urinate more frequently as the uterus presses on the bladder. Weight gain changes in the alignment of the pelvis and changes the hormones contribute to hypermobility from joint laxity, which can lead to postural compensations such as flat feet from fallen arches or feet that appear externally rotated from overpronation. This uncontrollable physical changes will need to be carefully monitored by a fitness professional, with modification and adjustments to variables such as body position and exercise selection made when appropriate. In the third trimester of pregnancy, dramatic physiological change is slow, but the increase in body weight will likely continue to affect the client. A growing baby may compress the major blood vessels that run to and from the heart when the client is lying in a supine position, causing a drop in blood pressure, feelings of lightheadedness, as well as a reduction of blood flow to the baby. For this reason, it is recommended that pregnant women limit the amount of time in back-laying positions. A woman may also experience shortness of breath, swelling, backaches, and insomnia during the third trimester, making exercise progress and physical recovery from activity more challenging. There is also an inherent risk of diastasis, or the separation of large abdominal muscles, as the abdomen becomes distended, or during core exercises such as crunches and sit-ups.